We're talking about a serious subject, depression and anxiety in children and teens.
And joining us to talk about this is Dr. Daniel Bober, a psychiatrist and addiction medicine physician and diplomate in forensic psychiatry and addiction medicine. Welcome to the show. Welcome to Smartlife, Dr. Bober. It's great to have you.
Thank you, Catherine. Great to be here.
Now, is it because we're seeing a rise, or is it because the age of social media that more and more kids and teens are being diagnosed with depression and anxiety?
Well, I think it's a few things. So it's social media. So in 2007, the smartphone was introduced, and the sales were 1.4 million. The next year, it was 10 times that.
Wow.
So it's been an explosion of smartphones. It's the opioid crisis. So a lot of opioid overdoses, which we thought were just simply overdoses, were probably suicides. And then finally, because the stigma of mental illness has decreased a little bit, parents are more likely to report it as a suicide than they were before. So I think it's a few factors.
Dr. Bober, let's talk about the role of psychiatry. Most people will picture a psychiatrist, somebody laying on a couch.
Just like this, laying down.
Yeah, I'll lay down if you want me to. Talk about their problems, or psychiatrists prescribing medication. There's more to it than that, correct? Obviously.
So in the middle part of the 20th century, psychiatry changed. It went from sort of the Sigmund Freud idea of psychiatry, where people were laying on the couch talking about their childhood, to a more biological model. So unfortunately, a lot of psychiatrists now kind of push medication more than they do therapy, but there are still some that do both. But I always say to patients, skills, not pills. I always tell people, if you can do it with therapy first, it's better to do it with therapy without medication.
Correct.
Absolutely.
Skills, not pills.
Skills, not pills. I really do like that. Now, a depressed teenager, there's always what you think is an image of what someone who is depressed looks like. Maybe someone who's struggling in school, maybe someone who doesn't have friends, but that's not always the case. There's not a look when it comes to teens and kids and depression.
No, and I find that teens present differently than adults. A lot of teens present as very apathetic, or I call it the whatever sign. Is there something wrong? Whatever. Are you sad? Whatever. Like, they don't want to get into it. They have trouble verbalizing their feelings. So you really have to be in tune to any changes in behavior, like changes in their sleep, changes in their weight, changes in their appearance, not hanging out with the same crowd they did before. Isolation, withdrawal, exactly.
But what if there's no obvious signs and a parent is not privy to that, or a teacher even?
There usually is a sign, and the parents know the kids the best, so they know if there's a change from baseline, so they just have to really be in tune with that.
Absolutely. Now, is there a period of adjustment for these teens as well? Do they, let's say, maybe start with certain symptoms of depression and it sort of changes? Is there like a period like that for them? Not
necessarily. You know, we know that depression is caused by a combination of genetic factors and experience. So kids that maybe were exposed to abuse or neglect, plus they have a genetic factor. You know, if you have a sibling or a parent with depression, you probably have 2 to 3 times the risk of developing depression.
Wow.
For a lot of children, talking about depression or the thought of harming themselves isn't something they're comfortable talking about in open. Or if they do so, they don't want to, because they'll say, well, you just don't get it.
Right. And they shut themselves off.
They shut themselves off. They shut everybody
out.
They
shut down.
They shut down.
Exactly. You know, what's interesting is people who commit suicide over 50% of the time don't leave a note. So sometimes you just don't know why it is, and it can be a very impulsive act. It's not what people think, which is people sit around planning it over weeks. Sometimes it's a very impulsive act. They just sort of get the idea in their head, and they just do it.
Like, if I don't do it now, I'll never do it. Let me just get out of the way.
Exactly.
I can't find a
sometimes
pen
sometimes they plan it. Sometimes they're giving stuff away. They're making very sort of, you know, fatalistic comments. But sometimes they just do it, and there's no warning sign whatsoever.
What are some of the causes of depression for them to get to that point?
Well, again, you know, there's genetic factors, so sort of chemicals in the brain that aren't balanced, people say, but there's really no such thing as a chemical imbalance. There's no, like, test that we could do where I could say, well, there's not enough serotonin, there's not enough norepinephrine, you know. Right. So there's genetic factors, and there's also experiential factors, so things that people are exposed to that increase what we call the hormone cortisol in their brain, which cause them to be depressed.
Do they also need the help of a psychologist or a psychiatrist at this point?
Yes, I think, you know, once they're starting to show visible signs of depression and it's affecting their daily functioning, at that point they probably need professional help.
Okay. I want to pick up on something Derek said, Dr. Bober, which I think is important. You said that sometimes it could be an impulsive thing. So it's not planned out?
Not always. That's the myth about suicide, that people are planning it out for weeks. But sometimes people just get the idea in their head, and I'll tell you what really pushes them over the top are substances. If they're using alcohol, if they're using other substances, a lot of times that disinhibits them, and that takes away sort of that last line of defense where they're rational and they say, you know what, I shouldn't do that. That's going to hurt the people around me. A lot of times when they're intoxicated, that takes away that, and they just do it impulsively.
That's scary. Very scary.
What kind of steps can a parent take before they send them to a psychiatrist or talk to a therapist? Is there something they can do before that, or?
They have to keep an open line of communication. They have to be non-judgmental. They have to, let the kid come to them and show them that they can just listen without judging them and making them feel like they're pressuring them to do something. The worst thing you can do is get help, get help, get help, sort of cram it down their throat. That's just going to make them withdraw and retreat and shut down more.
There seems to be so many things that make you shut down.
It's true. And, as a parent, you blame yourself. You say, well, I didn't do it the right way, or, it's my fault. But, sometimes you just do the best job you can. And even when you're careful, things can still happen.
Absolutely. And that stress and anxiety as well, that's another factor. I mean, especially with school, academically, there's so much pressure on our
And I think social media plays a huge role because kids are stimulated 24/7. They can't get away from it. And it affects their sleep. Sleep is a big problem too. They put their phone by their bed, and all that blue light from the phone keeps them awake all night, and they can't get healthy sleep either.
Absolutely.
Are depression and anxiety, are they treated differently?
They tend to be like cousins, so they kind of come in pairs, but some people tend to be more depressed or more anxious.
More depressed or more anxious, depending on what they're going through.
Depending on how they present, yeah. Some people have what's called an apathetic depression, where they feel like they don't want to get out of bed, they're not motivated, and some people have an anxious depression, where they feel like they're crawling out of their skin and they can't sit still.
Okay, so that lazy teenager doesn't want to get out of bed, that might be sometimes a sign, or that you might want to start
that's true.
Exactly.
Sometimes teenagers are lazy, so how do you know the difference?
Exactly.
Well, you can tell by the fact that, if they're not going to school, if they're not doing their homework, if they're not taking care of their personal hygiene, that's usually more of a sign of depression.
Right, absolutely. At what point do you consider medication? Because we're talking about a child's brain, a teenage brain that's still developing. It's not like giving prescription to an adult. So what measures are taken in that sense?
What's funny is I'm a child psychiatrist, but I don't really believe in medication in children. I think you should try to not medicate your kids to the greatest extent possible. However, if you've tried therapy, if you've tried other things and it's not working, then you have to consider medication at that point.
Skills, not pills.
Skills, not pills.
Which is true, absolutely.
Yes, absolutely. You know what? I know a few people who have going through problems with their teenagers. It's terrible for the whole family.
It is.
It's for the mentors, everybody. Any final advice for them to help them go through
That's
this,
a tough
get through this?
topic.
As a parent, keep an open line of communication. Don't be afraid to get help for yourself, because if you can't take care of yourself, you can't take care of your child. It's like what they tell you in an airplane when the mask comes down: put your own mask on first before you put your child's mask on. Take care of yourself as well.
Thank you, Dr. Bober.
Thank you, Dr. Bober.
My pleasure.
Take care of yourself as well.
Thank you so much.
Thank you for joining us on
Thank you.
Smartlife.
Thank you.